We're talking here at the Global Brain Health Institute, which has a specific interest in brain health, in how do we develop healthy brains and how do we keep them as we get older.
It's just wonderful to see and hear everybody.
The opportunity for people in this program is to develop their own leadership style. So leadership's quite often related to context. It's a chance to find out what your style is, what your approach is, the one that works for you in the context that you're working in.
We're just coming to the end of our leadership retreat week. It's been 1 week-long experience for the fellows to explore their own leadership identities, but also to connect with one another. And today is the last day of that, and so we're getting ready to step into a session with some Global Atlantic fellows, some alumni of GBHI, so that the current fellows can come to understand or get some examples of what their leadership trajectory might look like through their fellowship year and beyond it.
Before the Atlantic Fellow for Brain Equity, I was a very productive scientist, but still very disappointed about having real impact in the field of dementia in Latin America. After the GBHI, I learned to create a kind of leadership that is completely different to my previous approach, based in empowering others, in raising the voices of people coming from underserved population and creating a common horizon across many different fields, disciplines, and regions.
The leadership training tries to encourage fellows to apply skills that they're learning in the leadership curriculum directly to the work that they're currently doing. So each topic, each session, each assignment has a question of reflection, a point of reflection for the fellows to think about how the current concept might apply to their own project.
What I've learned about the leadership from the program is to embrace change, be inspirational, be inspired by others. In the program, I met so many emerging leaders in the fields from different walks of life I could never consider before.
What's unique about the leadership training in GBHI is the diversity of people that the program attracts. It's the opportunity to bring all sorts of different knowledge and experience and engage with a clinical program that is evolving every year.
Today is a great day for the fellows because it's the last day of the retreat process. That is a really important process for the fellows to know each other, to understand what they want to do, to try to find common goals, and more importantly, to interact between the two cohorts that are very far away, but they share values, ideas, expertise, and it's a great opportunity to expand the collaboration.
I think what's unique about this fellowship is it's a chance for you to bring your skills and experience into contact with your fellow fellows and with a quite extraordinary faculty that includes medical and scientific perspectives, but also economics, arts, creativity, so that you develop firstly yourself and your skills, and that you're better equipped for the uncertain futures that we all find ourselves living into.
Our connection with new fellows, old and new, is very important. It is the network, the support that we grow, the perspectives, new perspectives and insights that we learn and embrace. And this is what leadership is about. It's not about being the loudest person in the room or the most confident person in the room. It is about embracing what is around you. The biggest takeaway from me from the leadership program was that leadership is by deed, not by word. And that allows me to bring people with me on the journey.